Hi everyone, I'm so delighted to have here today Dr. Jane Thomason for the Pharmacy Social Prescribing Conference 2022. I've met Dr. Jane 5 years back at the Blockchain Live Week, and she has such a wealth of experience, and I'm very, very excited to have her today, in which she was able to write the first article on mental health, and she'll be able to give more context for today. And the floor is for you, Dr. Jane Thomason.
Thank you very much. And it's such a pleasure to be with you. I'm sorry I can't be there in person, but I think it's a great opportunity to just try and share with your viewers about how the metaverse might affect health and social prescribing. So I've tried to present what are some of the key drivers and changes that we will expect. And obviously the pandemic has actually been one of the biggest accelerants for digital health and metaverse and decentralized finance and so forth, because everyone was at home. And so we all had to learn about how to work remotely. And I think that this has really opened the doors in healthcare, which is a very traditional industry, to some of the digital changes that we always knew were a potential, but hadn't actually come to fruition. And we also know that our healthcare system is unsustainable and that there's a pressing need for new models. We have long-term chronic diseases, including mental health, rising costs, aging population, not enough health workers and limited resources. So the system had to change anyway. We're also seeing some major shifts in healthcare at the moment. So the move, for example, of the big tech companies into healthcare. The monetization of consumer data and the creation of health data marketplaces is going to change the way that we own and consume our data. We're seeing Asia absolutely growing as a leader in digital health, and everyone started to move fast to a metaverse age. Since Mark Zuckerberg announced that Facebook was going to be Meta, but people have been working on these mixed reality settings for quite some time. So what we're going to be seeing that will be created over the next few years is something of a meta health ecosystem where we're seeing DeFi, NFTs, decentralized government, decentralized cloud services, and self-sovereign identity enabling the exchange of physical, economic, and content assets. This will be a token economy, and it will have its own currencies native to it. And people are going to be able to earn, spend, lend, borrow, or invest in both a physical and virtual sense in this meta health ecosystem. So let's look at some of the ways in which health is going to be deployed, in that the metaverse is going to be deployed in healthcare. So the first one, and a big one, and I'll come on to it for social prescribing a little bit later, is this capacity to be able to collaborative work. So create realistic working environments where 3D avatars can work together with digital whiteboards and digital workstations without having to get on a plane and all physically go to one place. They can meet without any complex conferencing equipment. And it's a space where it's possible to 3D model virtually anything, and real world specifications can be replicated by a digital twin technology. So people can be working together, for example, on the planning of a new hospital in 20 different countries, all working on a digital twin. And machines, systems, procedures can be tested through these digital twins to detect possible failures and improvements before carrying them out in a physical environment. So all of this collaboration can take place in the metaverse. Education is obviously going to be a huge one, where you can take learners within the human body, providing a 360-degree view of all ailments or replicating real-world procedures. The learning can be hands-on, so AR programs can simulate patient and surgical encounters, allowing students to visualize and practice new techniques. And these are immersive experiences where the students can actually experience the surgery as if they were the surgeon themselves. So education will be transformed into an immersive experience where learning is fun and success is rewarded, and data analytics target precision learning. Other applications in clinical care, avatars can provide realistic consultations, personalized care, treatment and diagnosis through data interconnectivity. And using these immersive experiences, real-time guidance can be provided in the surgeon's field of view when he's in the operating theatre. So AR provides new ways of accessing information that's compatible with surgical workflows and the sterile field of the operating room. So surgeons can use a heads-up display to provide a data overlay on the patient's body during surgery, or to visualize the entire procedure during pre-surgical planning. And the AR and medical imaging can provide the clinicians with the ability to project medical images, such as CT scans, directly onto the patient and in alignment with the patient's body. Beyond Metaverse is one example of a Metaverse ecosystem that's being built to empower clinicians to practice their skills with the utmost precision to ensure everyone everywhere receives the best healthcare delivery anytime and anywhere. And the AR and VR is being used for surgical simulations, diagnostic imaging, patient care management, rehab and health management, and education about conditions or treatment plans. And it allows simultaneous education, training, and planning, as well as collaborative medical procedures. And it empowers clinical decision-making and ensures the right interventions and treatments are customized to each patient, creating a personalized approach to care. We're going to see increasingly the use of gamification. And I use just an example of this, particularly in wellness, where we're going to see healthcare providers and patients connected in wellness and fitness, where AI is used to deliver smarter workouts with guidance from virtual instructors. And an example of this is a new move to earn game, where players are incentivized to be active. So GenoPets actually uses data tracked by smartphones or fitness wearables to advance the GenoPet NFT in the game. So players have these little GenoPets and they can be rewarded for walking the dog, dancing in the room, running your daily 4K, or just getting up and going about your everyday life. And so GenoPet's mission is to make staying active more rewarding through a fun, free-to-play NFT game that allows players to earn through exercise and fitness. Monetization is going to be a big change that we'll see, especially in relation to patient data. So we'll have all of the gaming, the play to earn, learn to earn, and move to earn. And data owners are going to be able to monetize their data through health data marketplaces, which will connect and monetize data and make it available for scientific discovery. And this will be enabled through self-sovereign identity, which will make it possible for individuals to hold and monetize their health data. So we're going to see increasingly consumer-focused healthcare data, healthcare driven by data, and consumers will have the data and information they need to proactively manage their own health and wellness and make better informed decisions. Because where are patients' data now? Everywhere, but in their own control. It's in the hospital, it's in the healthcare providers, it's in the health insurers. And this is going to enable people to have a lifetime healthcare record within their own control. Now, in the area of social prescribing, if you think about all of these things that I've said, and you think about the possibility that patients can have a personalized, immersive experience and meet 3D support avatars, meeting face-to-face without any conferencing equipment. They don't have to physically go there. And depending on what their needs are, within that metaverse, they can access different community groups. They can access social services like housing and finance. They can access activities and experiences like virtual travel and shopping. They can access information, and support workers can receive education in that metaverse. If you then think about where that can go, and this is perhaps something for your community, what we're seeing is digital communities forming networks through token economies. So my question to you is there the possibility of a social prescribing community-owned economy? So we know that the attention economy will be replaced through social tokens in the metaverse to bring a new immersive community economy. So social tokens could be based on a social prescribing economy, and this could create bi-directional relationships between providers and consumers and other participants with benefits on both sides. So the individual consumers can also become the agents of innovation in a distributed model of collaboration. So think about the possibility of a social prescribing community-owned economy that will allow all players and partners, whether they're pharmacists or whether they're community support workers or whether they're consumers of the service or whether they're government or educators or people who simply want to contribute their intellectual effort to the whole project, could all be involved in this social prescribing metaverse. Because what you've got, and remember, it's not people of my generation who are going to be using this, it's the digitally literate youth who will be incentivized to learn, follow wellness and educate their peers in a safe social virtual setting. This is a powerful thought. Health education can be provided through immersive micro modules that can be taught online to anyone, anywhere. And augmented reality opens the possibilities to overcome community worker shortages. So this is the ability for the community, patients, and experts to be rewarded for their efforts and opens a whole new economy and earning opportunities. So think about building your own social prescribing economy in the metaverse. Having said that, we're not there yet. And while many people are announcing that they're building metaverses, we've got a number of challenges to overcome, and many of them will be ethical and values-based choices. So should the metaverse be opened or closed? If you are the creator of the metaverse, who owns it? Should avatars have agency? Should avatars have human rights? How are we going to ensure data security and privacy and rights in the metaverse and protect consumers? How do we manage and mitigate the physical and mental health impacts? Are children allowed in the metaverse? How can we create an equitable, inclusive and decentralized metaverse which maximizes the benefit and minimizes the harm? There's many, many important ethical considerations. As this technology creates these new possibilities and gives us new choices, as we're building the future, we are responsible for the things that we make, and we need to get the ethics right, and then we can look back without regret. So these are the possibilities that we have in the metaverse for healthcare and for social prescribing. And I see the possibility of creating your own token economy around social prescribing. Thank you.
Thank you so much, Jane, for this very powerful presentation. It was just mind blown with the amount of concept you shared today. And then for the delegate I'll be watching, it really kind of opened up the vision of what they can do with the social prescribing, which is currently set in our way of thinking that the patient gets seen by the healthcare professional or by the link worker, but through the metaverse, like you said, we're creating a new economy, social token, and definitely creating a new industry, which is kind of providing more benefit for the patient to learn about public health messages, learn to earn, and like you said, gamification by having move to earn by playing game or having game prescribed to them, which kind of open up potentially the sector of metaverse therapeutics almost. And just like for some of the delegates that might be kind of wondering, because it's such a massive information like given to them, for any of the delegate wanting to get started in these, potentially either as trying to create their own startup or potentially join a startup, what should be some of the key skills they get involved to kind of become part of this new industry from a pharmacist perspective?
Look, I think that that's a good question. I think the first thing that I would be recommending to them is they start looking at videos, YouTube videos about the new community economies and the social tokens, and just start seeing what's actually going on there, because a lot of the innovation is actually going on in gaming. But if you can turn your mind to learning about what's happening in gaming and then thinking about how it applies, you know, to social prescribing, and you don't have to build it yourself. And I think this is one of the things that's really important for people to understand about Web3. It's open source. So if you are reading and learning and viewing and you see a kind of social token that looks sort of interesting, that could be modified in some way to fit the social prescribing community, you can either try and collaborate with them, or you can ask them to white label it for your own purpose. Or if you have coders, you can take the code and then make the adjustments to the code that make it suitable for your own purpose. So that's the beauty and power of Web3, and why it moves so fast, is that people don't need to code from scratch. They can go onto GitHub, they can find the code, and then they can build on the work of others. But I would also really encourage people to get involved in meetups where they can meet, you know, other people who are working on Web3 or Metaverse. Go to conferences and just learn, because, you know, I think these concepts are applicable to so much of our lives. And as an example, the city of Korea, of Seoul in Korea, has announced it's going to put its entire public administration into a metaverse. So, you know, if you start to rethink about government services to people and how they can be provided, but they can be linked to entertainment, they can link to commerce, they can link to community groups. It's a really powerful thing to think about how it could be used as an incredible tool for social prescribing.
Thank you so much, Dr. Jane. And to finish up, let's say if some of the delegates would like to follow up your work, what would be the best way for them to follow your work? Will it be through LinkedIn, through Twitter? Do you have any?
Yeah, I think I have LinkedIn and Twitter. Just connect with me on LinkedIn. If you want to send a message, please, I'm happy to receive messages. You know, I hope that at least my presentation has sparked you to rethink about how we can help people in this new digital age.
Thank you so much, Dr. Jane. Thank you.
Thank you.
Yeah, I think you should be able to stop the recording.